and we should
Recording in progress.
we should do a roll call. So start with Paula,
Present.
Harry,
Present.
Jerry,
Present.
and Kevin.
Yes, actually, in regards to this, even associate members, Rick?
On the roll call?
Yeah, because I sent that across to a day earlier when I saw the minutes as well. I don't, we're non-voting members. I don't know.
If it's necessary.
Yes.
I thought it related to the remote nature of the meeting, that for the public's sake to know who were the participants, but maybe that's something.
If that's the case, I'm fine with it. I just don't want us to be, have us voting for something we're not allowed to be voting for.
Yeah, this is just acknowledging your presence, actually.
Okay.
But it might be worth checking with town council if we have to do this. I thought we were asked to do it.
Okay. Yeah.
In terms of today's agenda, we actually have a fairly short meeting when I look at it. We'll review the minutes, do our public comment if there is any, an update on the rodent control and the needs assessment, and the usual monthly report. And that's it. I don't, there just wasn't a whole lot coming up. So with that in mind, in terms of the minutes, they looked okay to me. Paula, Carrie, any comments, suggestions?
No, they look good.
They looked
They
okay.
looked good to me as well.
Okay. So I'll make a motion to approve the minutes for August 10th. Do I have a second?
Second.
So before you go ahead and vote on that, Rick,
Yes.
I did have sent across for a day to take Jerry and I off that. But so the question I have is, are we roll calling to open the meeting, or are we just roll
Yes.
call?
Well,
There's a difference between the two. If we're just saying roll call so everyone knows who we are, that's
Yes,
completely different and accurate. But Jerry and I can't vote to open the meeting. So I just want to make sure we have a distinction.
right. I think it's just to acknowledge your presence at the meeting.
Okay, for the public's sake.
For the public's sake.
All
I
right,
don't
so
think
I just want to make sure
we're not voting anything.
to open the meeting.
Right, we're not voting to open.
Okay,
Yeah.
that's fine. Then Cassidy, sorry, you probably need to put our names back on that roll call. Sorry. And before you all vote on it.
We can do that. And,
I will do that once the meeting is over.
okay.
Okay.
You'll add Jerry and Kevin. So I had a motion seconded. Now roll call, this is a vote. Carrie,
yes.
Paula,
Yes.
and Rick, yes. Okay, the minutes are approved. Okay, we have public comment. See Nancy Doctor is online. Nancy, do you want to make a comment, or are you just listening in?
I'm just listening. Thank you.
Okay, good. Welcome. By the way, I think Jackie McCarthy said she wasn't going to be able to make it tonight, so we'll send her from the meeting. Okay, a day rodent control update. We had a big discussion last time. You did a very dramatic demonstration. Probably more about rodent contraception I ever wanted to know, but do you have an update?
Sounds good. All right, so our schedule was a little bit delayed because nobody wanted to take responsibility for the old big boxes from Yankee
Oh.
Bed. So we, we reached out a few times to have them remove their big boxes, and then finally at the end of last week, we got approval from them to dispose of the boxes at our expense. In other words, they didn't want the boxes back. So we had to collaborate with DPW to help us safely dispose of those boxes. We placed the ContraPest boxes, big boxes, at the Washington Park on Tuesday, 7 boxes in total. 3 on the left side. So like when you walk into the park, we have 3 on the left side, and then we have another 3 on the right side, and we have 1 at the back. So our plan is to monitor the level of the liquid every Tuesday for the first month, and then we would readjust accordingly if needed. So with the previous pest control system we had in place, the bait boxes to the right of the park were completely depleted during disposal, and the ones to the left were partially depleted. So we expect this will be the same for the new boxes that we just installed. We're not 100% sure. You know, we have to get some data, and I believe that by next Board of Health meeting, we would have enough data to share with the board. So right now, we will consider this a pilot study until we can get some data in. So we have the Excel spreadsheet on the screen, so you can see that on 9/12 activity level, none, just because, you know, we just placed them there, and, you know, first day the big boxes were placed at the park. So I'm sure that when we go back on 9/19, which would be next Tuesday, we would have something to record. And then we'll do that for the next 4 Tuesdays, and then readjust our plans accordingly. So that's it for pest control for now. I'll keep everybody updated at the next meeting.
Okay, great.
Thank you.
Thank you
Thank
for
you.
doing that. You know, just to make a note that from what I recall from your presentation or the one before that, was that this requires that the gestational period for baby rats and mice is like 6 or 7 weeks. And so if in fact the high activity that the poison boxes showed, I would think that we wouldn't start to see a decrease in you know, activity in these new boxes probably for 6 to 12 weeks, right? Because we have to go through a cycle where there are fewer babies born, which in turn results in, you know, fewer of them feeding at the boxes. So it could very well be, just as a heads up, it might not be till November or December where we start to see, you know, kind of a decrease in activity. Does that make sense?
Correct. What I initially wanted to propose was to do both. So if we had continued using the poison, we'll continue killing them. And if they keep drinking the contraceptive, they won't be able to have offsprings. So
Yeah.
that was what I was proposing at the beginning. That would have been the best way to get the maximum result. But unfortunately, you know, we did not do that. So we would have to wait a couple months to get results.
Okay, well, we'll get there.
Yes, we will.
Okay, any other comments on that? Otherwise, we'll move on to an update on the community health needs assessment a day.
All right, Cassidy. All right, so things are starting to look good in terms of the community health needs assessment. The community health survey tool has been completed, and we are ready to promote online access. So we're asking all residents to complete this survey to share their experiences related to health and quality of life in Reading. So this is a Reading specific survey. We urge residents to fill out this survey. If you do not live in Reading, please don't fill this out. So on the screen right now, there is a JPG version of the flyer, and this would help us get the word out. We also have a PDF version that can be attached to emails. So we plan on sending those out as well. And for the people watching us right now, you can scan the QR code on the screen to begin filling out the survey. It should only take about 7 minutes of your time. At the end of the survey, there will be a gift card raffle for participants. We didn't put up the Spanish version yet, but we have the English version and we have the Spanish version. And also, once you go into the survey, you can use your website language settings to view the survey in your preferred language. So we're only going to print out paper-based versions in English and Spanish only, and those will be distributed to the public library and the Pleasant Street Center. So right now, we urge our residents. This is a Reading specific survey. We urge our residents to, scan the QR code and fill out the survey. It only takes about 7 minutes, and they have the opportunity to win, a gift card after. We're also going to coordinate with the library and other town departments to get the word out. We plan on putting this on our social media platforms as well, on our website, for easy access. So I think, actually, I just got this today, so we're off tomorrow. So the process will probably begin on Monday. So that's what we're looking at the moment.
Ade,
Yes.
I know we were kind of brainstorming on where to make sure there was access to this. And I don't remember if we had talked about making them available at the flu clinics.
Yes, they're going to be available at the flu
Okay.
clinics. They're going to be available at any town event. They're
Okay.
going to be available at the library, Pleasant Street Center, everywhere. Social media, website,
Town hall.
We're actually going to post the QR code at the front desk, and anybody that walks in can just scan it and start filling.
Great.
And we're going to make it as easy as possible.
What about the high school?
We can do that as well.
Just a
It's not a
thought.
problem.
I mean, because
Yes,
so
I believe every town department would have access to this QR code. And we specifically targeted the Pleasant Street Center and the library because we have some of our residents that are not tech savvy, that still prefer like the paper-based surveys. So we would have some paper-based surveys at the library and the Pleasant Street Center. And also, if anybody wants a paper-based survey, they can always give us a call. Our phone number is right there. We can always mail it out to them if needed.
great.
Ade, what do you see the time frame? So this is gonna start on Monday. What was the plan in terms of the time frame for doing this? Is it a 4-week
I think it was
survey?
about 6 weeks.
I thought it was 6 weeks. That's Jamie sent out an email today. Did you see it, Rick?
Yes. Oh,
It
yes.
said 6 weeks. It said 6 weeks in there.
6 weeks. So we're looking at completing it by November 1st.
Correct.
There, around that. Okay. And can you sort of remind us what the thinking is about, at what point we would be hearing from peer associates around, them pulling together the data from the interviews, the focus groups, the survey, and sort of coming up with their interpretation and, ideas? Is that going to be, would that be at a November meeting or
I think it's going to be after the holidays.
after the holidays?
Correct.
Okay, so that's strung out a little bit longer than their original timeframe, I think.
I believe so, but I would have to check on the timeline again. They had some resignations.
Oh,
as
oh,
well.
right, they lost, yeah.
Correct. So,
So we're looking at probably having a substantive conversation about the results of all this data gathering, probably not till right after the holidays.
I believe so.
Okay,
I believe so. If anything changes, I will, update the board
sure.
next meeting.
Any other thoughts, comments, suggestions, or anything around the needs assessment in general or the survey in particular?
Just say I've been really pleased with the work that Hair Associates has done with us. I think they've been great, really thorough, responsive, very professional. So it's been a good experience from my perspective.
That's great. I agree. I would agree.
I look forward to seeing the results.
Yes.
Okay. Moving on in terms of the monthly report, a day.
All right, moving on to the monthly report. So for the month of August, we completed 7 food inspections, 5 food re-inspections, 2 food complaints investigations, 3 temporary food inspections, 1 housing inspection, and 1 trash inspection. In terms of nursing updates, COVID specifically, there were 22 confirmed COVID cases starting from September 1st to September 14th. So pretty much from the beginning of the month till today. So the first quarter of the month, which is September 1st to the 7th, we had 9 confirmed cases. And the second quarter, which is September 8th to today, we had 13 cases. So, there was a slight increase in cases, but at this point, there is no cause for alarm. In terms of vaccination updates, COVID and flu vaccines are scheduled for our residents on September 22nd, October 13th, and November 3rd. You can see it on the left side of your screen. Residents as young as 3 years old can get vaccinated. Residents can also get vaccinated for shingles at these clinics if they are eligible. I'm working with the vaccine company, Shaw's. I'm working with them to see if we can add the RSV vaccine. They're very receptive about that, and they mentioned that they were going to do that, but I don't see that option yet when you try to sign up. So I'm hoping that we will have these vaccines available to the residents as well. I don't have an exact date. It is possible that before September 22nd, we would have RSV included. But for right now, it is not included, but I'm hoping that it will be. We're also hosting COVID and flu clinics for our elderly residents and residents of senior housing. 2 of those clinics will be held at the Pleasant Street Center on September 19th and September 27th. So that's to your right on the screen. We're also going to have one at Cedar Glen Senior Housing on October 4th, and another one at Frank Turner on October 12th. So we urge, residents to get registered, sign up, and get boosted if they need to, get their flu shots, whatever they need to do. They can just go to the website. The information is right on our website. Click on the sign up now button, or you can click on the specific dates to the right and follow the prompts, follow the instructions, and you will get registered for the flu and COVID vaccine clinics. And for children 6 months and older, they can always go to the Greater Lawrence Family Health Center. The way it's scheduled with us right now, we're only doing 3 and up. So if you want anything 6 months to 2 years, 11 months and 29 days, you would have to go to the Greater Lawrence Family Health Center. And that information is on our website as well, 34 Haverhill Street in Lawrence. And the phone number is there as well. And yeah, that's it for now. Everything else is looking good. It's been a little bit slow, but things are being taken care of.
Wood, don't say that.
I like to be transparent.
I know. Man, with fire.
So,
I had a question about just about the COVID vaccine. So I know that the newest booster was just approved the other day, and so you're be ready for supply to be available starting with that September 19th clinic.
Correct.
Yes.
Yes, absolutely.
It's great. Thanks.
Thank you.
This afternoon, I sort of did a website survey of surrounding towns, North Reading, Wakefield, Stoneham, Winchester, Woburn. And I didn't actually, going to the health department websites, I didn't actually see any organized vaccination programs sponsored by the health departments. And so this is actually a lot more than other towns are doing. Obviously, a lot less than when we were in the middle of the pandemic, but that's appropriate given the low level of cases. I think also, and I was talking to Aday about this, I think with now the widespread vaccination at local pharmacies, CVS, Walgreens, Rite Aid, Shaw's, Stop and Shop. I mean, there are, compared to 50 years ago, when the only place you could get it was your doctor's office. And so the health departments had to run these large programs to make it more accessible. It's a lot less of an issue in terms of accessibility. The other thing Aday did mention, he mentioned to me, was that we're also doing vaccination programs for city employees as well. That's, offline and not public.
Correct. And in terms of the shared grant, there's no new information at the moment. We're still trying to hire the inspector position. We've interviewed a few candidates, and we plan on extending an offer to one of the candidates early next week. So once we get new updates, I would have the coordinator attend one of our meetings and meet with the board.
And there's been no hiring of the public health nurse position for that.
No, even for our vacancy, we haven't received one application.
What a
we had-
shame.
Yes, we had an LPN inquire about the position, and I had to let the person understand that, you know, you need an RN certification to be a public health nurse for the town of Reading. So,
And that's a 40-hour position, yes?
37.5,
37.5, okay.
right? But I think at the moment we're doing a pretty good job.
Yeah, I'd say.
Yeah, I signed up for Maven, so I have access to, you know, the disease surveillance for the town of Reading. And I also enrolled Reading in the contact tracing grant. So now we're getting help with contact
Great.
tracing.
Good.
So
That's great.
without the nurse, I think we're doing okay.
Yeah, Carrie?
Jake, can I ask, has your shared services group, completed an MOU at this point? And
Yes.
does that include, public health nursing services so that if you had a need, you could reach out to one of the other communities and see if they could provide some support?
Yes and yes.
Good.
So everything is under review at the moment. We should hear from them next week. And that's the reason we held off on extending an offer to the candidate, because the budget still hasn't been approved.
Yeah.
We're hoping that it will be approved early
Yeah.
next week, and then we can extend the offer. And we anticipate that the MOUs and everything else will be approved early next week as well.
Yeah, so I mean, that's, I think, one of the, I mean, I think there are a lot of advantages to shared services and just. But I think that that is one of them. I think that that opportunity for coverage, particularly if we're, you know, if we are understaffed for a reason, if you did run into an issue, I think that that's great. So I'm glad to hear that we've proceeded that way.
And the same would be the case for, I mean, the three positions in the shared services grant are the coordinator, an inspector, and a public health nurse. And so their services, well, particularly the inspector and the public health nurse, could be shared across these communities in varying amounts as needs come up. And so this is, you're right, exactly right. This would be perfect.
Right,
Correct.
well, but
That's
so
why-
when I,
Go ahead.
sorry, I just wanted to, so with those positions not filled for us, but if another community in the shared services group has a nurse, we're able to reach out to our partner and perhaps tap into information under the MOU, or does it only pertain to the regional STEM?
So we're looking at two things here. So in
Right.
terms of the inspector position, our goal is to pursue standardization.
Yep.
First thing we need to do. Once we do that, that would ensure that we're all using the same software for inspection, and we're all conducting inspections the same way. That
Yep.
way, we can have the shared inspector come to Reading, do inspections based on certain standards, and then apply those same standards to not Reading, you know, to avoid any type of discrepancies.
Yep.
So that's the first. Second, with the public health nurse, we would actually grant access to our disease surveillance. Reading specific disease surveillance will grant that access to the public health nurse, to the shared nurse, so that the nurse can access our data.
Right.
Correct. And that's all in the MOU and in everything. So
Right.
that's the plan.
So it doesn't pertain to existing staff.
Well, right now, under the CTC grant, I actually granted 3 staff members access to Reading specific data so they can help us out with contact tracing. So the key here is to, you know, grant them the permission to access our data. And if we're going to do it with the public health nurse, we have to make sure that everything is in writing as well.
Mm-hmm. Absolutely. Thanks for doing all that, Ade. And I'm sorry, in full disclosure, I am currently managing a shared service arrangement in another part of the state as well as a regional field training hub. So I have my own knowledge. We're pursuing the same kinds of budget approvals and the like.
Okay, any other comments on the monthly report or I was, just in terms of final comments, I was remiss at not congratulating, I think, Carrie and Jerry on being reappointed.
Thank you.
Additional terms, you can't get rid of us, you know,
Right.
you're stuck.
Right.
But thank you for your service. Otherwise, you know, like Ade said, it's really been kind of a quiet month, and you know, I'm looking forward to the services agreement, you know, the community health needs assessment, because that'll be fun when we can really dig into that and do some good work. And hopefully things will be quiet on the respiratory illness front this winter, so we'll see. Right. Any other comments or suggestions? Okay, so I'd make a motion to adjourn. Do I have a second?
Second,
Carrie. Roll call, Paula,
Yes.
Carrie,
yes.
Rick, yes. See everybody.
Thank you, everybody. We'll
Thank
see you.
you.
Thank you.
Bye.
Bye.